So why are we here? Well, I know you are here because this topic sounds interesting to you. And this is the leaking patient whose doctor kept gaslighting her. I think this is really painful because I feel, and you would understand when I read out the question, this is somebody who's experiencing betrayal on two levels. First, her body is not doing what she needs it to be doing. And then her doctor is the same, not doing what she needs the doctor to be doing. So let us go ahead and read the question. And let me say a very quick thank you to the lady who posted this. You know yourself. I would definitely put the link to this video in response to your question so you can catch up and you can read it by yourself. But thank you so much for posting it. So it's in response to a video I did and I was talking about the pelvic floor in that segment. So you said, I have both. When I sneeze really hard, when I have a bad cough, and sometimes when I hear water running, I need to go. So I try to hurry to the bathroom, which is kind of hard to do with two very arthritic knees that need to be replaced and can hardly walk. I've been doing Kegels, that's Kegel exercises, and it has helped, but it still happens at times. I've told my doctor that, and basically they say to keep doing the Kegels and gaslights what I'm telling her. I am so sorry that you are experiencing this dissatisfaction with your condition and with the medical response. I'm really sorry. And one of the things I'd like to do as we carry on in this video is, offer some suggestions about how to deal with medical gaslighting. And if you remember, I said I was discussing pelvic floor problems. I was discussing the pelvic organs and pelvic floor related problems. I think I was discussing something to a larger context in any case. But when she says I have both, she's referring to something we call incontinence. That's the leaking that we're talking about, leaking urine. Okay, so the first one she's talking about, when you sneeze or when you cough. And ladies, it's not just when you're older. Okay, you might experience this if you're overweight or if you're pregnant, because these are things that increase the pressure within your abdomen. And the problem is that increased pressure, if you have a weak pelvic floor, when you sneeze or you cough or you laugh, it just relaxes that pelvic floor and the bladder just opens and then you leak. Because don't forget, the pelvic floor are those muscles that are holding your pelvic organs in place, your bladder, the womb, and the rectum at the behind. So if that pelvic floor is weak, you could have things like leaking. You might have things like a prolapse, which is when a bit of the organ pushes down into the vagina or beyond the vagina because the pelvic floor that's supposed to hold it in place, hoik it up like that, is not working properly. So the first one I've just described to you is called stress incontinence, because some form of stress has caused the pelvic floor muscles to weaken, and because they're weak, the bladder just opens. The bladder is supposed to hold the bladder in place, keep its neck closed until you release. When you feel the second type, because she says I have both, is the second type of incontinence or a second type of incontinence, and this is known as urge incontinence. This is the one where you must desperately, you have to get to the toilet, because if you don't get there now, you are going to embarrass yourself. It's called urge incontinence. So this is the second type. It might even be triggered if you hear water running, and it just sets off a desperate desire. That's why it's called urge incontinence, and you just have to go now. Now, this one is not because of a weakness of the pelvic floor, right? This is because your bladder is overactive. So your bladder is hyperstimulated. It's really not responding properly to commands from your brain as it should. And there could be different reasons for this. A bladder infection, for example, a side effect of certain medication, for example. Now, one thing I didn't mention when I was talking about the stress incontinence is that actually Kegel exercises, which are meant to help to strengthen the pelvic floor, can be very, very useful. And that is why, our sister said she's doing her Kegel exercises, but why isn't she getting any joy? Why isn't it getting better? Well, the reason is because the Kegel exercises can be fine for the stress incontinence, or at least can help with the stress incontinence. They're not going to do nothing for urge incontinence. That's a different kettle of fish. It needs a different treatment. So I'm really cross with her doctor, who apparently is gaslighting her. So either not taking the symptoms serious, not listening, because it's really uncomfortable. We struggle enough already with women who don't even want to come and talk to us about these problems because of how embarrassing it is. But here you have somebody who is talking about it and asking for help, but she's not getting it. And there is help available. I insist that you go back to your doctor and say, look, this has been a problem for 6 months, 12 months, whatever the case may be. In the past, I've mentioned it to you, but I feel nothing is really being done. And I would really like us to do something about this. I believe I'm suffering from both stress and urge incontinence. I understand that stress incontinence can be helped with Kegel exercises, but urge incontinence cannot. I would like you to have a look at, why am I experiencing urge incontinence? You can take a friend, you can take a buddy, because it might just be useful to have somebody there as either a witness, or if you forget something that you need to add, they can help you put that up, because sometimes it can be a bit stressful. Next thing that you could say, if you feel as if you're still not getting anywhere, is I've read that a bladder diary can be useful. And see what your doctor says, because you're asking, can I have a bladder diary? So a bladder diary is nothing complex. It's really just a record of what is happening in terms of your drinking and your passing urine. So it's like an in and out kind of diary. But what is useful about it is not just telling your doctor how much you're drinking and when you're drinking and what you're drinking. It tells them how many times you're passing urine, what the situation is when you're passing urine, like I said, how often are you going to the toilet? When do you experience these problems? When do you leak? Put it down. You can say, I would like a specialist referral. And it might be a referral to a physiotherapist, because physiotherapists are really very good in terms of looking after pelvic floor and bladder related conditions for both men and women, but especially in this case, because actually pelvic floor related problems are a lot more common than you think. And I know we've gotten away with the feeling that it only happens to women as they get into menopause. That's so wrong. Pregnancy, just being pregnant, can weaken the pelvic floor. And it doesn't mean that once you've had the baby, the effect on the pelvic floor just disappears. The muscles could still be weak. And many women could benefit from actually having a session or a few sessions with a pelvic floor physiotherapist to help them retrain their bladder, re-strengthen their pelvic floor. Even if it's just one meeting where they teach you the right exercises to do, that could be very, very useful. I wouldn't class you as a difficult patient. You might have complex requirements. You might need to book a double appointment. But some of my tips when you're dealing with a health professional and you feel as if you're not getting anywhere, don't be afraid to ask a friend to come along. I actually achieved my goal. And then, of course, if it doesn't work out as you're hoping, if you've not achieved the goal that you want, if you've not, if you feel that you're still being gaslit, you can always ask for a second opinion. And thank you so much again. I think it was a really important question to ask. Thank you so much. I really salute you. I think you're being very proactive. I hope your next visit with your doctor is productive and gives you the results that you want.